Hey, I wanted to talk to you about something that I don't think is discussed often enough when it comes to rhinoplasty, and that is the skin. So much of what we talk about with rhinoplasty is how are we going to change the bone, how are we going to change the cartilage, that sort of thing. But how can we make those changes? And then, what do we put over the top of it? Well, it's the skin. And if somebody has thick skin or thin skin, it makes a difference in terms of what we can do. So one of the things that I think is very important for someone with thick skin is that we make sure that with a thick-skinned nasal patient, so somebody whose nose has thick skin, that we try to get that skin as healthy as possible beforehand. So for example, if you've got oily skin, if you've got, kind of blackheads on your nose or that kind of yellowish, whitish stuff that comes out of your nose, trying to get that cleaned up beforehand will help. There are times when I've done a rhinoplasty on a patient and all this white material comes out of their nose, and I know they're going to have a prolonged healing period. So whatever we can do to get their skin healthy is important. The way that I like to get the nose healthy is, well, at times if it's severe enough, I'll start them on Accutane, which helps dry up that oiliness of the skin. But topical tretinoin, not isotretinoin, that's Accutane. Topical tretinoin can be very helpful. Getting them on good medical grade skincare. There are a lot of patients who they're willing to spend $20,000 on their rhinoplasty or whatever, but they won't spend $500 on good skincare. Using a good cleanser, using a good face wash that's going to get the oils out of your skin, using good sunblock that is going to mesh well with your skin that's not very oily, using like a microderm scrub, all those things can help improve your skin tone and texture and get you a better result. So those are just a couple of examples of things that we can do beforehand as well as after. Another thing that we can do after the surgery is injections. I'm a big believer that injections with a steroid as well as 5-fluorouracil can help decrease the buildup of scar tissue, and I believe they make a difference. And then finally, massage. Like, we can actually mold the nose. So massaging it, trying to get rid of the dead space, flatten out the skin, can make a big difference in terms of smoothing things out and making sure that the nose heals well. So if you have questions about nasal skin after rhinoplasty, let me know, but it's something that I think is vitally important and something that isn't talked about often enough.